Thank you for tuning in to Love in Your Hands with Cynthia Clark, the podcast about how to live life with love, passion, and purpose. This podcast is sponsored by loveinyourhands.com, the place to find long-lasting love through the merging of ancient science, modern technology, and quantum physics. Tired of superficial connections? Go to loveinyourhands.com and start your free Align to Your Soulmate 5-day challenge, where you could win a $20 Amazon gift card. Now here's your host, Cynthia Clark, certified palm reading consultant, love compatibility coach, author, and speaker. Hi there, everyone. Thank you so much for joining us today. I'm Cynthia Clark, and I love talking about issues that help you in your life. And I love starting out with a little palm reading lesson because, of course, your hands actually do reflect everything about you. So not only on a physical level, but also on an emotional and mental level. And today what I want to talk about is the type of lines that we have can actually show us how we are responding to our thoughts and our feelings and our vitality. So if you have lines, okay, so I want you just to take a look at your hand. Everybody has a lifeline, which wraps around your thumb. Everybody has a headline, which goes across your hand. That's how you think. And a heart line, which is your emotional flow line, which is the top part of your hand, starting under your little finger and heading towards either your middle finger or your index finger. Okay, so those lines are super, super important because they are your major lines. Every single person has these lines in some capacity. And I won't get into all the variations because there's thousands of variations that can show up. But what I want you to look at is the quality of the lines. And the quality of the lines are going to show when you have a stress or a trauma, or if something is off kilter in that area. So for example, if you have what is called chaining in your lines, that's going to show a stress to the line. We want to ideally see the line as a clear single line, okay? So it should be deep, it should be clear, but guess what? Most of the time this actually is not the case. And go figure that, right? So if you have what's called chaining, it literally looks like this. It's like a chain link that goes around, and it's almost like the line is braided. Okay, so if you have chaining on any of these lines, that's going to show up as a stress. And that also shows up as something that maybe needs to heal within you. So if it's on your heart line, it shows an emotional healing that needs to happen. If it's on your headline, it shows that you worry or you stress out with your thinking. If it shows up on your lifeline, that's a physical stress. So you probably have something wrong that needs to be addressed. So take a look just at the quality of your lines today. And we are going to learn a lot about health today. I'm really excited. So I'm happy to introduce our very special guest. Today, we have Dr. Manon Bolliger, who is a board certified naturopathic physician who has trained 2,000 students in her methodology. Wow, that's a lot of students. From rural farmers in Nova Scotia, CEOs in Toronto, and triathletes in British Columbia, she has helped thousands of patients listen to their bodies and heal. So thank you so much for coming on the show today, Dr. Manon.
Well, thank you. Thank you. I'm really excited to be here and and share whatever I can to, spread the word about health and what that means and all of that. So
yeah, so let's start out the show. I like to start out with a story because, of course, this is Stories in Your Hands. And so I understand that you had cancer, which is like, oh my gosh, that's so stressful. So why don't you tell us a little bit about that backstory and what happened on that journey for you?
Sure. And I was going to say, I was looking at my hand going, interesting. That may well have been a stressor. And if I understood a little bit more about that, I have questions for you as well.
Yes, your hands reflect everything.
Yeah, no, interesting. No, I do have a line, but it's interesting. It goes off, but the main line goes all the way through, right? So, yeah, anyway, I was thinking, I wonder which off it is, because I think part of my journey as a, not just as a naturopathic doctor, but as a person in the healing profession is, deeply down, I think you've got to learn by life lessons. And so at least that's the philosophy I've taken to my multitude of stories, many health stories I've had that have come along my path. I've had scoliosis, I've had multiple sclerosis, I've had stage 4 cancer. So, I mean, they all have been learning blocks for me. And I feel in a strange way that it's like a blessing in disguise because I'm still here. and I've learned so much of what I don't know and what I didn't know at the time. So talking about the cancer situation, what I was already, a naturopathic doctor. I already had a practice. This is 20 years ago, and I've been in practice for 30 years. And I was thinking, well, I'm actually eating organic foods. I'm being super conscious about, my lifestyle. I was living at the time, on a farm, so that I had outdoor air and exercise, and and I felt aligned with the lifestyle I was living. And so I'm thinking, wow, like I have not been trained sufficiently to understand why I was diagnosed with literally I had a 1-year-old. So that's when I found out. Now she's 21. And I had 2 older children, so 35, 30, and 21. And I couldn't understand how I developed, cancer. And, I'm thinking, okay, it could be pollution, could be this, could be that. I looked at every factor, but I was so meticulous in all of these things. And what I underestimated fully was the impact of not feeling, like the stresses that can happen by the type of relationship that I attracted in my life and the needs that I have. Like there's no such thing as, one guilty party in a relationship. A relationship is by nature 2 people. And whatever I had not resolved that allowed me to attract the nature of relationship I attracted caused tremendous stress for me. Because, if you're used to airing out your feelings and talking about things, and your partner, that's not their nature, these are all stressors that you ideally work through on some level. But you also need to know when it's time that you're against a brick wall, and sometimes it's not the right thing, and partners need to move ahead separately, which is what happened in my case. But the stress I had, and I think I've seen this now, in many of my clients, is the belief that somehow we're strong enough. We've got this, so,
Yes.
so, it's like, sure, I've got this, I've got two, at that time, I can't do math off the top of my head, but, young teenagers and not even teenager. And then a newborn breastfed child. And I wake up to, going into the oncology ward, literally saying, and doing the biopsy and going, oh my God, you've signed the dotted line. We're taking your uterus out. You have stage 4 cancer, and having this download of, incredible guilt, you know, well-meaning, you know, the nurses and doctors saying like, how could you do this to your kids, not go ahead with the therapy? Because I was wondering to myself, based on my knowledge a little bit, if we take out a cancerous organ, do we actually resolve a cancerous relationship? And
Good question.
And my answer was no. And every cell in my body was screaming, this is not in alignment with your healing process. This is not what you're supposed to or meant to do. And I'm not prescribing this, by the way, that
everyone's individual, of course.
Everyone's individual, and sometimes surgery is absolutely the right thing. So I'm absolutely not saying do like I did, but I had to be true to me, which is what I tell, you know, all my patients. Be deeply aligned with your core values. Because if you're not in alignment, that's when, you know, illness and therefore, and so I'm sitting there and they're like hovering above me, telling me like, you know, how dare I do this to my children? You know, I need to be around. And then they kind of came with the legalese, because many cancer wards are part of researches that they're doing, you know, concurrently. And part of the research here was hysterectomies as a helpful way of dealing, you know, with stage 4, like cervical cancer. And then they had said it had spread, and I'm like, no, there's something not right with this. It's not even the same histological cells. Like, this doesn't make sense. And then they're, you know, showing the paper, and I just remember it just like, it's like space travel in that moment. But I just got up and they said, if you walk out, we will no longer be able to follow you, which I understand because it's a study. But it really put me out of the whole medical system, because I had refused treatment. Now I'm an adult, so I'm allowed to, but there's really no support for people who have, you know, either information that differs from, you know, what is conventionally or normatively believed, and or pharmaceutical information that people receive. So it was quite a thing to get up and do this. But
yes, no kidding. That's brave. That's
it was brave, and most people thought stupid.
Yeah.
So it was very ostracizing. It was very difficult, and it's not like it really taught me that the one in charge of you is you.
You know? Yeah, take responsibility for your health and your body and yourself. Yeah, it's so true.
100%, you know, and so that's really deeply what I learned. And the other part that I learned, which of course it's more and more popular now, because we talk about mind-body connection, and we talk about, you know, there's not one without the other, but we may play lip service to it to a certain degree. You know, it's like, go see a therapist or psychologist or psychiatrist for issues of the mind, and then go see, you know, another type of therapist or doctor for issues of the body. But in fact, our body and mind are one. Every cell in our body is imbued with the memories that we've experienced, with the traumas that we hold, and with the stories we tell ourselves.
Yeah, absolutely. And it all shows up in the hands.
Yeah, and I'm fascinated. That's why when we talked, you know, about the interview, I was like, oh yes, I want to find out more also what you do and how that ties in, because it's been very interesting for me to be witness to my own experience. And of course that has deepened the work I do, and in, you know, creating Bowen College, which is where I teach practitioners now to do this methodology that combines very clearly mind and body, but it's actually through the body.
Yeah.
So we
I want to learn all about that. That sounds so fascinating.
Yeah. So anyhow, so that's kind of my the short of my story.
So you obviously got better.
Oh yes, and
So,
I did it completely naturally. I had no chemotherapy, no surgery, no drugs. I did a hell of a lot of inner work. I really, really, in fact, my listen program, and I'm writing a book which will come out in the spring,
mhm.
is all about that the journey of how to listen to your body when it speaks, and and I kind of broke it down to different steps in this, and it's a spiral process. It's not like start here then end here. It's like you start here, you can go this way, but you're basically spiraling deeper and deeper into your essence of really who you are being on this planet. And the more of that emerges, through you, the freer you are. And on some level, health is it's freedom from physical pain, from emotional pain, from mental pain, and stories that we hold as if that is our only identity, right? Because if we're attached to our story, we're
Right.
not free to evolve, right?
Yes, and I look at illnesses as just the physical manifestation of something that needs to heal internally anyway. So, if you're not healthy, there's a reason why you're not healthy. That's besides the fact that you may be eating the wrong things or, not exercising or whatever, all the obvious stuff. There's so much more to it than that.
Yeah, there's so much more. And that's why it's like, at that time, I thought it was really about eating healthy and being fit. And
Mm-hmm.
those things do help. Of course they help, but there's more.
Yes.
And that's the thing is, if you've got one piece, what other pieces are you maybe missing? And missing as in you have them. It's just you're unaware of them, right?
Mhm.
You know,
Right.
it's
Yeah. So take us through a little bit of your processes and how do you help people?
okay. Well, okay. So I have two parts, and then let me see. How much time do we have?
Oh, let's say 10 minutes.
Okay. No, so I'll give you the general overview, but it is a physical therapy, which it's called bone first therapy, is the main portal. But the training of the therapists who do that work is through my listen program, which is the context for healing. It's actually the understanding of the space that you must hold and the healing you must have gone through internally to be able to amplify the physical work. So there's that component, and patients or can also do that very same work. It's not exempt from all people. The more people who actually do that introspective work, the more they're primed to heal. So my understanding is that we have innate intelligence, and healing is simple. And if we can trigger that innate intelligence, the body is so perfect and so beautiful. It knows exactly what to do, and we don't have to do anything. We just have to surrender. But there is like a trigger point there, because we're spiraling down another path. So how do we awaken to allowing and receiving that healing? So I'll talk about the physical part first. So in bone first therapy, it is an orchestrated set of moves that it's like a cross fiber a stimulation that really talks to the fascia. And the fascia is an underestimated and was very much discarded organ, which now they've started to understand that everything goes through the fascia. It has its own nervous system, our circulation, our lymphatics, our immune system. It is all, surrounded by this gelatin-like matrix. That's not like a layer, but it's around everything. So just to make it like clear in case people like, what on earth is that? Fascia is a connective tissue that surrounds us from the top of our head to the bottom of our toes. And it's kind of like the angles of pull, if you think of it like a saran wrap. If you have a crinkle in the top, it's going to pull somewhere diagonally or vertically or horizontally or in all matrix-like way through your body. So the idea is if you can speak a language to the body, which is what I believe Bowen First Therapy is, it will unravel these tugging points and allow the body's communication system to work really, really well. So that's the simplified version of it. The technique itself is very simple. It's not hard for the practitioner to do. It's not hard to receive. And what it does is it puts you in what's called parasympathetic mode. And we have our autonomic nervous system has two components, sympathetic and parasympathetic. And sympathetic is that fight, flight, and freeze mode. Parasympathetic is that rest, repair, restore, digest, and go figure, healing mode. So if we can, and most of us are in the sympathetic overdrive. So in my case, I was absolutely in sympathetic overdrive. I did not know, there was no shut off. Like I was just on, and on means none of this other part can work. So, and again, heal or heal thyself. There's a part where, it's like the shoe, what's the expression in English? The shoemaker's shoe, or shoes are never, well, their kids never get proper shoes. What's the expression?
I'm not sure about that one.
Well, it might be a French expression, I don't know. The cobbler is something, the cobbler's kids never have shoes or something like this. Anyway, but it's common in healthcare practitioners that they don't do to themselves what they, what they recommend others to do and what they actually do as part of their practice. So
right, they don't take their own medicine.
Exactly. I took part of it, but I didn't take a very essential part of it, which would have allowed me to deeply reconnect with my body. So that's a piece of it, and the rest is the context that I'm talking about. And listen to me, it's an acronym. So L stands for love, and it's how you listen to your body, because we're so used to, in our culture, being against our body, fighting our body, upset, like, oh, that darn hip, and we're constantly as if the messages of the body are to be shut down, right? As if somehow, we need just to take a magic pill, an anti-inflammatory, steroids, whatever it is, just shut it up. We're
right.
We're fighting it, right? Instead of going, oh, interesting. What are you telling me with this? Interesting. Right. I see. And noticing, when our body speaks this way. So, but the first thing is to actually fall in love with yourself and with your body. And that is really hard, because we live in a society that it's very much a me society, but it's not a deep love of me.
No, there's so much criticalness that comes through everything that we are taught. It's like we beat ourselves up constantly. I need to be thinner. I need to be,
exactly.
My hair is a mess. That's how we grow up, basically.
Yeah, exactly.
And that's not very loving when you mention that.
So no. So that's part of the piece that needs to shift. And the second letter is I, and that's inquiry. So it's really questioning our thoughts and beliefs. And there's Byron Katie has a fabulous method. And then, I have something that I've been doing with my patients that really works, but it's about really questioning the things we take for granted, and finding out if it's actually not only true, but aligned with the essence of our core values. So that's I. S is symptoms as symbols. So people tend to describe their, so I would just come up with an example. Like, let's say you have your nose obstructed or your nasal passages obstructed. And it's like, you could say, well, even you might say the word obstructed or plugged, or, and the thing is, you can look at analogies in your life. What else is obstructed? What else are you living that way? What other ways? And it's unbelievable how many times there's analogies in other parts of their life. The way, like I had an actor patient who felt paralyzed on stage. And the use of paralyzed came actually because that's the word, and it's a problem with the fascia. And when it's a problem with the fascia, we use words that have meanings that are descriptive meanings of emotion, because it works with our basal ganglia. So we tend to describe, not like hot, cold, burning, but paralyzed is not really, it's an emotion. It's not actually a descriptor like hot or cold, right? Or burning pain. And so his experience of paralyzed came to an anesthesia he had 10 years ago, which actually was for dental work, which is like, it's all normal, right. But his body had a different experience of normal. And it affected his vagal nerve and also like his diaphragm. So every time his body would go into this state, though his mind had cleared it, right? He felt like, well, I've got this. And he had done tons of work with his mind and with all kinds of coaches, but his body had another story. So that's, again, understanding that connection. And T is touch. It's all about all of fascia and, the piezoelectric effect. And I'm not going to go into details, but the importance of touch, because we need that. And, we're now in a society where, because of bullying, because of all of this, where, teachers can't hug their students, students can't touch each other in the playground. We've become absolutely fear-based protective, in part because, there are things that happen out there in the world, but we're making that the predominant scene, and
we're overcompensating it the wrong way.
Absolutely.
Yeah.
Couldn't agree more.
Yeah, we need to come back to some balance.
Yeah, for sure. And then E is empower and engage. And this is really about the energy level of our body. How do we create the energy and the vibrations where, and this may sound all kind of woo-woo, but it's really clear to me that we are an energetic body as well as everything else, and how we feel things and the thoughts and beliefs and the emotions that go behind things affect our cellular level. And they now had this study with monks that meditating had a major impact on the frequency levels. So it's like, there's more and more coming, to make this sound less woo-woo, because science eventually catch up with what we see in reality, right? Yeah. So we're up to N, and N is now. It's time to take action now, because later is later, right? It's like,
it's like, how long do you want to be sick, or how long do you want to have a problem? It's like, all of our power is in the now.
Exactly.
So
exactly.
starting with the awareness that there's something that we can do individually to create our health and well-being. You know, one thing that I love, like everything you're saying, it makes so much sense. But yeah, one thing that I feel like people really struggle with is that they think about aging, you know, and they think about, oh, I'm 1 year older, and oh, I'm getting old, and maybe they're only in their 50s.
Yeah.
And it's like, well, who said 50 was old? You know, who came up with that number?
Mm-hmm.
And so I like the concept of agelessness.
Mm-hmm.
You know, it's like, well, yeah, you live another day or another year, and it's like, but you don't have to be old.
Right. But those are societal constructs, right? Like,
Right, exactly. So yeah,
what we make it.
if we can apply all of these, you know, just ways of thinking and feeling, it's like it can affect your health on so many different levels. So yeah, I love
100%.
that.
No, it's literally, when you say story, it's the construct that we impose upon ourselves from unquestioned thoughts and beliefs,
Right.
and then suddenly we're thinking 50's old, and therefore we're starting to act decrepit, and our bodies, like, we, you know, they say that it's, I think, I forget the statistic, but it's like, in of our visual perception capacity, we're only zeroing in on 10% of what is actually in our visual field. And it's what you bring your attention to. So if you're thinking, you know, that you're old, you're going to find the evidence to prove it.
Absolutely.
So,
yeah.
And after enough evidence, you're going to go, yep, told you so, I'm getting old.
Exactly. It just reinforces what you believe. So
Correct.
So tell us, how do people work with you? And it sounds like you also teach. So let's talk about that.
Okay. Well, I no longer see one-on-one patients, because my dedication is to get this workout worldwide. So the best way is through Bowen College. So it's not Boeing like the airplane, it's Bowen like the island, BOWEN college.com is my main website. And I have, you know, programs that help the a person who wants to become a practitioner, but I also have programs for the public, because to me, my bigger vision is a healer in every household. Somewhere in there, we know that if we have the ability and the resources to take charge of our health, then we're going to learn how to navigate whatever therapies are out there. We can navigate the conventional system, but we can also navigate all the therapies that are out there, because there's so many therapies. And how do you know what's right for you? And where do you start? And all of that. So that's one of the things I train. And then I have a brand new starting podcast called The Healer's Cafe. So that, of course, I'm going to be interviewing all kinds of therapists to really explain how their path went to the therapy and what the therapy can do for people. Because I really think that we need to get, you know, informed consent really means knowing what's out there. And often your medical doctor is not aware of what's out there. You know, like, for example, nutrition.
Right.
Medical doctors aren't trained in nutrition.
No,
so
they're trained to specialize in whatever it is that they do. And
well, that's true. And what they do is manage disease. It's a disease management system.
Right.
It's
exactly.
It's not actually a health promoting system. They haven't learned how to promote health.
Right. Yeah, that makes perfect sense.
Yeah, which is kind of a crazy thought.
It is, which is why, they tell you that the drugs you're going to be taking, you'll be on the rest of your life,
Exactly.
because
Because
it's
it will matter.
it's managing a symptom.
Exactly.
Yeah. Well, this has been so interesting. Thank you so much for sharing your wisdom and sharing your stories with us.
Yeah, well, thank you for allowing me to do that and spread, my message, but also empowering people to wake up.
Yes, wake up, everybody. You can take charge of your health. Start
Yeah,
today.
absolutely. And there are really ways to do it. So,
Yes. And remember, you can live your life regardless of your story, whatever it is, whatever illness you've had.
yeah,
You can do it. So,
absolutely. And you know what? I just thought I have actually a free gift. I don't know if you.
yes, we love free gifts.
Sure. So at the same address, bowencollege.com, then you do / and it's free, spelled FREE dash book. And it's the book I wrote 5 years ago, What Patients Don't Say If Doctors Don't Ask. So I'd be happy to give a free copy to anyone interested in that. And I have an upcoming book, but it's upcoming. So,
okay, great. Yeah, I'll make sure I put that link in the notes. So,
great.
all right. Well, thank you so much. And everybody have a wonderful day. Thanks for tuning in. Thank you for listening to Love in Your Hands. Please rate, review, and subscribe to show your support. This podcast is sponsored by loveinyourhands.com, the place to find and keep long-lasting love. Start your free Soulmate Connection membership today using the most innovative and accurate algorithm to match you to potential partners, all at loveinyourhands.com.